Thank you for joining us for today's Practice Advantage Pearl. Today we're delighted to have with us Dennis Wipperling, a seasoned healthcare leader. Dennis has had the experience over the past 30 years of working in a number of different settings, including academic centers, integrated healthcare delivery systems, single specialty clinics, multi-specialty clinics, and all that experience comes together in leadership positions. Today he's currently employed with a single specialty practice in St. Paul, Minnesota. Today's topic is strategic planning. And if I think about the old Alice in Wonderland, the Lewis Carroll story, the Alice is at the crossroads, the Cheshire Cat is there, she's not sure which way to go. We fast forward that to today with a GPS. So Alice is looking at the GPS and she asks the question, which way do I go? And the answer is actually still the same unless you've got a strategic plan, which is it doesn't really matter unless you know where you're going. You've got to program in that endpoint or that destination. So Dennis, what are some pearls you can share with us today about how to get to that strategic plan and have that strategic direction?
Dale, you're aware that medical practices are experiencing more change today than ever before. External forces are driving most of these changes, and it's important that practices are aware of these forces and decisions made by others outside the practice and not allow them to determine the destiny of the practice. An example of the changes are hospitals and health systems purchasing physician practices at an ever-increasing rate, or they're hiring physicians as employees, and they're competing with the local independent physician practice. With change comes opportunity. It's important that these practices understand the change and the opportunity that's in there. That's where the strategic plan is useful. A strategic plan is like a well-thought-out itinerary for a multiple-day cross-country road trip. It begins with a destination in mind. It includes specific information about the routes, places to stay, and it also includes alternative routes, travel, and places to stay in case there's road construction or other situations that would interfere with the travel process. It's important that practices who have ideas and those that have a vision have a plan, because the strategic plan takes those ideas and vision and turns them into action. I'm going to give you an example of a couple different practices. One practice has just lots of ideas. They start down the path of implementing an idea, but because the idea is not well thought out, they have difficulty in implementation. And then comes along a second plan or second idea. And all of a sudden now their focus shifts from their first idea to their second idea, and they begin now to implement the second idea. And the practice then continues in this sense of implementing ideas as they come up and not ever really fully implementing any of the one ideas. The second practice example is almost the exact opposite. It's been a practice that's been in operation for about 20 years, and they like how they do things and they like how they are. Unfortunate for the practice, there's a lot of environmental changes occurring, including competition moving into their market area, a number of their physicians reaching the retirement age, and reimbursement from payers reducing it at a very high rate. Both these practices need a strategic plan to help them kind of focus and to take advantage or respond in a proactive way to the change that is affecting them. The first step in developing a strategic plan is for the practice to do an assessment, and it begins with them understanding clearly why do they exist? What is their purpose? That's referred to as a mission. What is their mission? The second is for them to look at what is their vision. Probably the best way to describe a vision is to answer the question, what does the practice want to be in 3 years? For example, for me, I may have a vision that says, I want to be a millionaire in 3 years. That's a reasonable, maybe it's a reasonable vision, but The next step in the planning process, I think, is important. It's kind of the reality test. It looks at the practice's strengths, it looks at their weaknesses, it looks at the opportunities and the threats, and it allows the practice to understand, do they have the ability, do they have the capability, are there external forces that may keep them from accomplishing their mission? The next step after completing that assessment is to look at past performance. I think you've heard it said, Dale, that past performance often is an indicator of future performance or future results. Looking at information in that context is really important. Also looking at information out in the community, what's happening with the competition. Also looking at what's changing with the demographics in the services that's being provided. Once the practice has completed this kind of full assessment, trying to get as much information as they can, the next step is to really put together a list of like priorities, ideas, projects, strategic initiatives that when these are implemented will assure or help the practice accomplish its mission. Again, the strategic planning process is as important as the final outcome of the plan. And it needs to include as much as that can be anticipated. Now is the time for the practices to take charge of their destiny, take a really strategic look at all the opportunities that are occurring in change, and really make a plan.